Great, thanks, Dorian. So hello, everyone. Lots of nice messages. Some people based in London, but working from Leicester, and we've also got some international callers as well. So it's great to have you all. So my name is Mirek Skrypak. I'm a Director of Quality Improvement at North East London NHS Foundation Trust. And I'm tasked with trying to help build a quality management system. And there's been some fantastic learning and sharing and webinars already on this topic throughout the Q community, predominantly with the work that Joy and Emma have been doing. But there's also a special interest group that we've got, which Tom convenes, and then there are lots of questions, and it's a hot topic at the moment. So it's great to have you all. We will do some introductions shortly, and then there'll be a question and answer session that I'll have with Tom, as opposed to doing a presentation. And then we'll get some feedback from our panel members. And then you'll have an opportunity to go into breakout rooms to reflect on what you've heard and come up with some questions on your own for the panel, and also to spark off some discussion. And then we'll see where that takes us, but we will hope to finish between 1:15 or 1:30, depending on how the discussion goes. So if I could just get our panel to introduce themselves, and I'll start with you, Emma.
Good afternoon, everyone. I'm Emma Adams. I know a few people on the call looking at the names that are popping up. So nice to see you. And for those who we haven't met yet, also nice to see you. I'm a quality improvement specialist, having worked in the NHS for a very long time. And today, I guess, I'm bringing the learning that we've been collecting over the last few months around quality management series through some webinars we've been doing for the Q community. Some of you may have been on them, and we're about to start series 2, or as my colleague Joy Furnival calls, our second album. So that's starting on the 18th of November. And what we've been doing really is deep diving into quality management systems, sharing what everyone knows, sort of some of the things that we've picked up through the Q community, but through wider networks as well. So I'm by no means an expert in any way whatsoever, but hopefully I can pick up some of that learning and share that back as we start our discussion. So lovely to meet you all.
Great, thanks, Emma. And Isabel?
Hi, everyone. Like Emma, I know a couple of faces. That's nice. So I am the a quality superintendent. I'm working in radiation oncology services. So I've been using QMS for quite a long time. So happy to be here to share some of my experience. And yeah.
Great, thanks, Isabel. And Jem?
Hi all, so I'm Jem. I'm the Quality Improvement Lead at Central London Community Healthcare NHS Trust. So we are about to launch on our own QMS implementation. So I think we're in a similar position to you, Mirek, and we've been piloting implementing a QMS within our team for the last year. And as a result, we've also been co-convening a QMS implementation leads network to bring together others who are in a similar position to try and learn from each other how to go about doing this in the NHS.
Great, thanks, Jem. And Tom, over to you for an intro.
Hello, I'm a retired electrical engineer, a chartered engineer, and a chartered quality professional. I've worked in industry for 50 odd years. During that period, my task has been predominantly electrical engineering, but I've also been responsible for quality. And I've worked with quality management systems for over 40 years, and that's including designing and implementing quality management systems with the extension of the ticket qualification, which is the software development quality management system. Since retiring, I joined the University of Birmingham as an honorary research fellow, and just after that, Q started, and I joined Q, and I've been a member of Q since then, which probably is almost 6 years. My research at the University of Birmingham is in process management in the NHS, which is definitely a key element of quality management.
Great. Thanks, Tom. So now we'll move on to the bit where this is the interview. This is me coming to Tom and coming with about 6 questions, and then Matthew and Joriam, just in case I get struck by lightning or my internet connection does. Hopefully you've got the 6 questions that if I disappear, you can carry on asking Tom so that the session will go ahead. But sorry, just need to prepare for any technical difficulty. So, Tom, I'm a director of quality improvement. There's obviously other individuals that I work with in my foundation trust, but people in my organization use the terms quality management system and start describing our quality management system. So what does that mean? What does the term quality management system mean?
Well, a quality management system has been designed to manage the quality of a defined product or service. It's generally recognized that you do this. To do this, you need to manage the quality of the product and service realization process, not just the product. The realization process is how you deliver the service or how you manufacture the product. It doesn't really make any difference whether we're talking about a service or a product. Quality management uses the same tools and the same principles for both. This includes not only the design of the product or the service, but also the design and commissioning of the product or service realization process. So in order to deliver a service, you've got to have the service infrastructure, all of the staff, all of the equipment, all of the facilities in place. And it's the design of that that is part of the quality management system. And in fact, unless that is managed and displays the right degree of quality management in its creation, then you're never going to manage the end product quality. Any quality management system must be able to demonstrate, that's evidence, quality assurance to its stakeholders, customers, and potential customers. Now, I'm just going to share my screen. I'll try not to be too long on this. I've developed this resource for this webinar, and after the webinar, this will be available probably not till the end of the week or so, because I've got a bit more work to do on it. This is really the index to a whole range of resources associated with quality management. And this illustration shows my view of what you need to have in place in order to start managing quality. So the actual quality management system is only a small part of what you need. The whole design of a service starts from a specification and it ends with feedback to improve that specification. Those going from the specification to improvement of a specification, it is enabled by a learning system. And unless you've got a learning system in place, you haven't got a quality management system. So just to have a look at what a quality management system consists of, I'll just go through some of, I won't go through all of the writing in here because we haven't got time and I'll bore you to tears. I'll just go to some elements of it to give you some idea of what I think a quality management system should look like. So here we have the ISO 9000 illustration of what a framework, if you like, of what a quality management, the elements of a quality management system. And you can see it's quite complicated. There's a lot of stuff in there, in addition to just providing quality customer satisfaction. There's all sorts of different elements that have to be undertaken. And quality management now is often done or is best done, in my view, through what's called a process approach. And a process, this is an illustration of what a process is. And you end up with some inputs, you do some activities on those inputs, and you have some outputs. So I'll talk quite a bit about, well, I'll probably talk too much about a process approach, but that is one of the ways of delivering quality. And in order to design a process approach, you've got to do some work design. And in this, I've got some ideas here on what a a process approach looks like. Sorry, I'm getting lost. And I'll go right down to here to the process approach. And you can have a look and read this and see what a process is about. But it says that if you want to manage quality, then your system, your realization system is made up of a whole series of processes. And it's how you define and manage those processes that gives you the quality of the end product and the quality of the realization system. There's a lot of terminology used in quality management that isn't quite the same as the terminology used in the NHS, unfortunately, but it would be great to have a more stable form of terminology so that the rest of the world knows what the health service is doing. There are some organizations now that are starting to look at how we should really be managing our processes and defining our processes. And one of the ones that I've been following is the World Health Organization High Fives project, where they've taken some particular processes and they've defined those processes, and then they've distributed those definitions or the documentation for those processes to several hospitals across the world. And then they've seen how the standardization of those processes has improved results. So you can read up on this in your own time. And it's coming to, I don't know if any of you are familiar with Get It Right First Time, I'm sure that you are. Well, they've just produced a new document, which isn't quite available to everybody yet. And it's about, they've started to define processes in more detail. And they've only done a few so far, but these processes are well documented, but they're not really in the form that would be used by in a quality management system. But this recommendations for the process could be transferred into a form that would be usable in the workplace. So what I'm trying to show here is that more and more people are adopting or trying to understand this process approach. I've got a bit more to show on this, I'm afraid. 10.4. Toyota Kata, I hear that mentioned in Q now and again, people referring to Toyota Kata, but all it is a process approach. They're saying that Toyota Kata puts most of its effort into the nature of people's actions in the process. That's what they actually do during their work. They're also saying that a lot of well, they're not saying the NHS as I am. They're saying a lot of management focus is on results and consequences rather than what goes on in the process. So I'm just supporting the fact that it's the process approach that's more important. And getting to Duran, he talks about big Q and little q and the product and the process, and he puts more emphasis on feedback from deficiencies. Now, deficiencies is a word that I've been giving some thought to. It could be a non-conformance, or it could be an error, or it could be some other bits of missing information, or it could be distractions. So there needs to be a bit of work on defining this deficiencies in a NHS setting. So I hope that gave you a little bit of an insight as to my view of what a quality management system looks like. So
no, that's right. That's right. It certainly has, Tom. So, so a lot of those things I've seen at my trust, I've seen discussions about processes. People talk Gamba, Keta, Toyota, Honda, Suzuki, all that sort of stuff. QI. I guess how would I know? There's a lot of talk about quality management systems, but how would I know if my trust actually has a quality management system?
Well, you'd be able to demonstrate evidence. You'd be able to evidence quality assurance.
Okay.
Now, if you believe Duran, there are three elements to being able to demonstrate quality assurance. That's quality planning, quality quality design, sorry, I'm getting a bit confused. Quality planning, quality improvement, and quality control. So that's the Duran trilogy. So you've got to be able to demonstrate them. And you can't do that by talking about it. You can only do it by producing the documentation that shows you're doing all of those three things. I'll just go back to sharing my screen again for a second. Just one quick little if you're getting fed up with this, tell me and I'll do a different
No, this is, yeah, keep going.
So quality management says according to ISO 9001, these are the requirements of a quality management system, and there's 3 pages here. The ones I've highlighted in red are where you could make a start at the top of the organization, and the ones in blue are where you could make a start at the bottom of the organization. Now, in order to demonstrate that you've got a quality management system, you need to be able to demonstrate all of these clauses in terms of a desktop demonstration. So you have to have documentation that supports all of this. Now that sounds quite a massive task, but it's fairly easy when you can put the whole thing online. In the early days, I had to do it all with a typewriter. But now it's so easy to be able to just display it all on a website like this. Yeah. So to answer your question, you've got to be able to demonstrate that you're covering the Duran trilogy.
Yeah, for sure. And I guess that what you highlighted there in terms of the red, you know, the blue and the black, the sort of desktop evidence, is that to meet the sort of ISO standard definitions of quality management system?
Well, there are a number of different models of quality management systems, and it depends on which one you choose, or you could go along with what the NHS likes to do, and that's sort of reinvent the wheel and produce your own design of a quality management system. In my view, that's just a total waste of time, because first of all, there are some really good models available for you to use, and also people outside your organization will understand, because they will know those models and they will have vast amounts of experience in implementing those quality management systems, and will be able to help you because it's a known system. Is that an answer?
Yeah, definitely. So I think when you say good models, so I've come across our colleagues up north, and hello to anyone from Scotland that's joining us. I've come across the Scottish QMS framework. Would you regard that as a good example?
Well, let's have a quick look at it. I guess some of you already have had a look at it. Their framework, it consists of a diagram, which I have got no problem with. You can see there they've got the Duran trilogy: quality planning, quality improvement, and quality control. The whole thing is enclosed by quality assurance. They've got a learning system. They talk about design and co-design, co-production. Yes, a lot of family members help with the healthcare of patients, and a lot of it's because it's such a holistic, humanistic delivery mechanism. Relationships are absolutely key. Also, you've got to have a clear vision and purpose, and you've got to have leadership and culture. I don't disagree with that at all. Unfortunately, if you read this document, Scotland says, oh, well, we don't like the word quality planning, so we're going to change it. And they don't like the word quality improvement, so they're going to change it. And they don't like the word quality control, so they're going to change it. And this is just a diagram. It's not really a framework. It's just a sort of a model. It doesn't tell you how to implement quality improvement. Just as an example, the Scottish quality management, this document, and no, when you go into the Scottish model, it's got in total it's got 10 pages. It's got this diagram, a driver diagram, and then 2 pages of tables of 2 pages each, and that comes to 10 pages. Now Duran in his quality handbook has got 1,136 pages to describe the same thing. And ISO 9000, the main ISO 9001 document is 28 pages, but it references 27 other documents. So 28 times 27 is 756 pages. And the Scottish quality model framework is done in 10 pages. So, you know, there just isn't enough there to enable you to design a quality management system. I like it. It covers the trilogy. I don't like the way they're changing the names, but fair enough.
And Tom, I like it because it's 10 pages. But anyway, so just finally, just from your point of view, and final wrap-up question: how will I know, you know, if we have a working and functional quality management system at my trust? So if we fast forward, you know, 3 to 5 years, or even longer, what's the fundamental thing that I know that we have succeeded in having a quality management system at my trust?
Well, the main thing is audit results and inspection results. But there are a number of other things that you can look at, and there are now quite a lot of competency frameworks and maturity frameworks. The Q, I was involved in the first round of Q projects, Q exchange projects. We produced a maturity matrix for basically improvement, not necessarily just quality. So you can test, and it's got, I think it's got 5 scales, some beginners and then experts.
Right.
The CQI, you know, all of the people that work in the NHS are professionals. They've done a whole series of very strict training courses, usually entailing 3 or 4 or more years at university, and then they've got loads and loads of skill through practical experience. The same thing happens in quality management. There is an organisation called the Chartered Quality Institute, where you have to be to become a member, you have to pass exams and show all sorts of experience. So it's these people that will say whether you've got a quality management system or not clinicians and nurses and other people that work in the NHS that aren't quality professionals. So the point I'm trying to make here is that it's no good saying, oh, we do quality improvement or we've got a quality management system, unless someone outside your organisation, especially your stakeholders and your patients, agree and that they can measure what you do against what's done nationally or internationally. And some of these competency frameworks are really good at doing that. There is an organisation. I'll just do one more quick slide. Sorry about this. And this organisation was put together by David Cameron when there was some sort of crisis in the public services, and he wanted to really get them moving a little bit. And he put together this organisation, and I think it's great. I've been knocking about with them for a while. Here we are. It's the Institute for Continuous Improvement in Public Services, and they've got a couple of competency frameworks or maturity frameworks that I think are absolutely essential for you to, if you're going to implement quality management, of which quality improvement plays a massive part. But before you can do quality improvement, you've got to sort your processes out. So it's all within a wheel within a wheel. They've got a really good competency framework where not only can you measure your progress, but you can measure your progress against other organisations, other public service organisations. And in fact, there will be some members of your trust that are already associated with this, because the people that work in finance will be heavily into this, because they'll be members of an institute of their own that is affiliated to this institute. So my answer is get some of these competency frameworks. Even your staff survey is really a maturity framework if you conduct it in that way. So you can really take some really good measures over time to assess how well you're doing and whether you've got a quality management framework or whether you haven't. Is that enough?
Yeah, absolutely. So Tom, thank you so much for that. That's me stopping my questions, and obviously this was just us trying to approach it in a sort of an interview type of format so that our participants could get some insight into the wealth of knowledge that's in your head through lived experience, obviously, and me being tasked with obviously trying to help embed this in my trust. So I know there's a couple of questions in the chat, so we'll just hold on to those, but I'm just going to go to my panel just for some reflections. And Emma, if we could start with you. So just any reflections or insights or things that you liked, or some challenges or some discussion that you would like to reflect on from your point of view?
I guess what I'm really reflecting on is language, actually. And it comes up in the whole phrase quality management systems. And we've tackled some of this in our webinars. It means different things to different people. And that's really important to notice when we're holding a conversation, because there are ISO standard quality management systems that are often applied in places like radiology or in our pathology, very much, contained units of our organizations where process can be defined and there's some clear quality assurance standards that you would expect to meet. Some of the conversations we've had through quality management systems webinars have been much broader than that. They've been about how the whole organization focuses on quality. How do we get to the point where it's in our DNA in our organization that we care about the quality we do, and we have not just technical methods and processes, but a cultural way of putting quality first and putting the patient at the center of what we do. And that wider term, I guess, is what a lot of us are starting to call quality management systems. So systems even itself can be a technical thing or not. But I guess what we're talking about is how does it become the way we do things around here in a systematic kind of way, but it's also culturally acceptable. And I guess that's when we're talking, we need to be careful that we understand the difference between that sort of quite process functioned quality management system approach and that broader organizational, can we see those elements of planning, control and improvement in a learning system that people can articulate. And so I guess that was the bit that was really calling to me, is we need to think about language. And that certainly came up with some of the discussions we had. Is it just the way we manage things? Is it just quality? Is it not a system at all? Is it just an organizational framework? Whatever. So I just think we need to hold some of that. I think the other thing is the real world, really. So often we don't have a very clear specification from our commissioners about what we're asked to do. It's quite broad. So it's quite hard then to turn that into standards. And so that's quite hard then to work against standards in a sort of quality assurance kind of way. I think the other thing is humans are not standard either. So that production of outcomes, to use those kind of frames, it's a really complex thing you're trying to pull together. And then you add in how the staff work and everything like that. So I think, just in my view, probably guard against assuming it's one thing and not another, and really just open your eyes. And I guess the best way to really open your eyes is to go and see. which is fundamental, I guess, to all of our improvement thing, is go and see what other people do. And is that something you like? Is that something you'd want to have? Go and ask people currently, so how central is quality to what you do? And you might get that answer from some of your staff survey results, but also just ask them those questions. And one of the things we really, some of the work I did in Portsmouth, we really focused on staff's interpretation of the organisational priorities and values. And we wanted them to get to a position where they were able to say, I know what's expected of me and why every day. I know why I'm here, and I know what you expect me to do. And then I know how well I'm doing today, and I'm able to fix it where I am as much as possible. And that relates to that quality control kind of element. And then the third thing was, I have available to me the tools and the support and the framework to be able to make improvements where I am. So that's, for us, was the acid test, as whether you could see you'd got quality management in place, is when you started to hear it from other people, and people felt empowered. And that's what we've seen in some of the showcases we have from some of the great organisations we had that presented in our webinars, is they're really looking at not just the technical methods, but where they hear that quality is foremost in everybody's mind, and it's in the way we work, and it's in our values, and it's in our daily routines and our habits and our behaviours. So that was my kind of reflection on some of Thomas's framework. I guess, what's in the real world? What have you already got? What else are other people doing? And how can you bring that together and think, well, how would we like to work where we are?
Great, Emma. Thank you very much for that. And then moving on to Isabel, into your sort of reflections on that Q&A session.
I think Emma's mentioned the language. It really, like, it resonates really well, because obviously with the ISO QMS, there are like very specific language they use. So it's very important we translate that and then use a language that healthcare staff can understand and relate to. Like Tom mentioned earlier, about reinventing the wheel, I saw quite a lot of model. They are all called QMS, but I think ultimately ISO 9001 is the quality model that is recognized across the world. We can create model based on individual trust or individual region or country. However, ultimately, as we speak currently, ISO 9001 is the only one that is recognized by over 160 something countries. So if you are going to implement this, you better have a shared language that you can communicate with all the quality professional across the world. Like Tom mentioned, the Charter Institute, I think those are there are a lot of experienced colleagues you working in quality. They are using exactly the same standard and framework, and we need to kind of not reinvent or waste our time to reinvent on those. And I think the external certification element to me is important, because there are lots of inspector, ISO 9001 inspector, they are trying to inspect a quality system with their the quality standards. So sometimes when we are looking at ourselves, looking at our own practice, there will be blind spot that you don't necessarily understand, but those are the things. That's why I think that external element is important, so you're not actually peer review yourself, your own practice or your own process. My personal experience, or the way I see a quality management system, is just a tools that we can use, and quality improvement, and a lot of the quality improvement tools is actually as a part of the bigger quality management system. So we talk about different 5 different colors of heads, or PDCA, length of so all those tools is just part of the one element in the quality management system. So when we when we manage our one, we look at how if this how we manage the non-conformances in our processes, how we manage manage like auditing our internal processes. How do we manage document? How do we manage like, you know, the training and competency of like, you know, in healthcare setting, especially? How do we manage our inventory, all your equipment, etc. And all these are like essential elements. But again, it depends on the nature of your discipline. What are you, you know, how do you use this tool? So like you will need to adapt your QMS in order to suit your needs. So like, you know, what Emma said, like, in a real world, like, you know, I think the tools like as using a QMS is just like 20% of what you need. The other 80% is all about like, you know, the relationship you establish with different teams in with different teams, different organization, or different interested parties, we call them, or like the stakeholder that, you know, they're called. So, you know, all this really need to work together. Is that, you know, it's a social and technical system we are dealing with at the moment. So like, you know, you can't really use a rigid technical tools and expect people to adhere to the, you know, to the word black and white. And yeah, so I think this is like, you know, my little reflections and the little note that I made. Thank you.
Great. Thanks, Isabel. And then Jem, last but not least, reflections from you, and you're sort of tasked with something similar that I'm tasked with. So yeah, interested in your reflections.
Yeah, thanks. So I fully agree with Emma and Isabel about language. I think that was the first thing that tripped us up. I think what we've got in the NHS is a very specific meaning to the word quality. I think it depends even where you go, what quality means, but it tends to fall broadly around, you know, customer, patient experience, patient outcomes, safety, you know, and those often fall within specific remits within an organization, and that makes just a conversation around quality management sometimes quite challenging, because if you look at what Joseph Duran meant by the word quality, it's not what we mean by quality. It means about, are you delivering to customer requirement, or are you delivering in a efficient and effective way? And I think that is the first thing we had to do, was think very carefully about what we meant by the word quality. I think when Emma said, like, fundamentally, are you putting quality at the heart of what you do? I think I've tried to use a word which originally I stayed away from when I first joined the NHS, which was using the word customers, because most of our clinical colleagues hate that concept. It's too businessy for them, is my experience. But I think it's such an important concept, because if you start by saying, are you aware and do you have a well-documented understanding of all your customers' requirements? That would be the first step in a quality management system, is saying, do you actually know what you need to deliver? And is that well documented? Because the biggest bit of learning for me, having spent a year attempting to implement a quality management system, is we didn't really understand our customers' requirements from a corporate team's perspective. And whilst, for example, my team don't deliver direct care to patients, understanding those needs were fundamental to making sure the way we work was designed to deliver quality in the broadest sense of the term. So I think that's a really crucial starting point. And I think, to go back to that question you asked about, how would you know you've succeeded? It's really saying, have you got those documented requirements? Can you demonstrate that your processes, the care and organizational processes that you have in your organization, are designed to meet those requirements? Now, that's a real challenge, because we often don't use process design thinking in the way we work in the NHS. We tend to evolve processes due to the, slightly chaotic nature of how NHS is subject to constant reorganization and structural change and challenge. It makes process design really difficult. But that's fundamental to meeting, delivering good quality. So I think that's one of the biggest challenges I've seen in how do you do QMS well, is how do you embed process design into the way we design the work that gets done. And then, then you're building in the control systems to say, how do you make sure you're monitoring it? How do you have those good set of indicators, not just of, are you doing the right things, but are they working? So you need to have, like, we've learned about the critical to quality concept, which is a really helpful set of indicators to tell us if we're doing our process right, not just if we're getting the right outcomes, but are we doing the right things right at the right time? And that's all the kind of the key bits that feel different to what we already know, because QMS is not all brand new. It might be a new language, it might be some new way of boxing up concepts that are actually familiar to us in many ways. But we, as NHS Trust, most NHS trusts will have many of these aspects already in place, called different things, often not joined together in a systematic way. And I think that's the challenge we need to navigate, is understanding, so what's different. But when we're talking QMS at its heart, what are we trying to do that's different to what we already know? If we've already got so many of these bits in place already, we talk about audits and safety thinking and risk management, we do all this, we probably do this as well, if not better, than other industries. So it's just saying, well, what are the bits that are different? And for me, the biggest bit is as you were saying, it's joining the bits of the system together, where things can often get done quite siloed, and we don't, as an organization, enable these bits to be connected in a coherent way, and that leads to challenges with the way we plan and manage services. So that's the big bits for me, and I don't know if I've gone rambling off on a topic or not. But,
no, not at all, Jem. Thank you so much, and obviously, what were great. So Tom and the panel, thank you for that. Now what we're going to do is curate a space. I'm making this sound more fancy than it is. Joram's going to slot us into breakout rooms, and then maybe if I could ask, if panel members get slotted into a breakout room, just remove yourself out of it, and then what we'll try and do is just answer some questions on the chat. So individually, you can just look at some questions. If you feel like you can answer them, go for it. But in the breakout rooms, guys, you should have maybe 8 to 9 to 10 of you there. Just reflect on what you've heard. If there's any questions you guys have, to discuss it amongst yourselves in the breakout room. And then obviously in 10 minutes time, those questions will field to the panel when we do the feedback session. So great. So Joram, over to you.
Okay, we're ready. I'm gonna pause this recording just for a bit. Recording. And here.
Great, guys. So I assume we've got everyone back. Joram, yep, a thumbs up from you. Great. If you wouldn't mind just muting yourself if you're not on mute, please. And we will go to room 1, which had Sam, Katie, Joanne, Ian, and Bruce. Can someone just provide some reflection and questions for the panel, if that's possible, from that room?
Okay, so there was more conversation about the language and how the word quality is used, described, defined, what it means to different people. So it feels like that's some work to be done in and itself, and probably, you know, someone just gave the example of, if I walked into the organization, you know, sort of senior group, and said, right, I want to talk about quality management systems and quality, there's like a couple of people that will put their hand up and say, that's my domain, rather than it being everyone's kind of co-owned domain. So there was a thing about language. There was a question about, well, how would we start to check if people are following a quality management system, you know, within a trust? Yeah, so I don't know if that's all I can think of at the moment. Who else wants to chuck anything in from the group?
That's great, and I'll assume the silence. So Bruce, that question you posed, how would we know if we're doing a QMS approach at the moment in our organization? Was that the question?
Yeah.
Yeah. So great. So our panel, is there a simple question or answer for Tom?
Yeah.
For Bruce?
Yeah. if you're following a quality management standard like ISO 9000 or some of the others, that standard will define what quality is. And it'll be the same as what Duran calls quality and what Deming calls quality. And it's based around the Duran trilogy. So quality is fairly easy to define. The other part of the question is how do you know if you're actually following the quality requirements? Well, the quality management system also tells you how to do that. It's your interpretation of those standards. And this question of language, I think, is just a waste of time. Why do you need to discuss what quality is when you've got loads of standards and people throughout the world, like Isabel was saying, understand what quality management is? And the NHS is sort of just talking about it instead of getting on and doing it. I find it desperately frustrating when all the information is out there. Someone mentioned, I think it was Emma, sorry Emma, that there's such a mass of standards, but they don't cover everything. You can find a standard for just about everything the NHS does, produced by the different organisations.
Unfortunately, Tom, that's not true. That isn't true at all. I mean, I work in mental health, and yeah, we've got some nice guidelines for some things, but for others we haven't. You know, and we do have some commissioning standards, and for others things we don't have. But also, I think that conversation about quality is much wider than what's defined within a standard, because it needs to bring in what Jen would call your customers, what patients, what families, what populations expect. And that isn't often defined in a quality standard. And so I think that broader aspect of what is quality and how do we all own it, whether we're in finance or whether we're in the portering department or wherever we are, in the organisation, that's what it's about. And I would say how you know whether you've got it or not is you have to go and ask people. And some of the key questions are, you know, why are you here today? Do you know what's expected of you today? Do you know, if I was to go into some of the organisation worked in, people wouldn't know how many people they were expected to see. They wouldn't know how long they were expected to see them. They wouldn't know what outcomes were really measured and were really important. And they wouldn't very often know the feedback from some of their own data. So that they're essential things that if you were to go and temperature check in your organisation as to whether you've got a really good management system, you might find them missing. And you see it flagged up all the time. You see it in your complaints, you see it in your feedback, you see in your variation in your practice. There's all sorts of things that would tell you whether you have or you haven't. It's not just in audits against standards. That's what I would say.
Is anyone suggesting that is the case? I mean, the NHS is the same age as me. And if I knew so little about the outputs of my life as you're saying the NHS know about their customer requirements, then I'd feel pretty ashamed of myself. The NHS know quite a lot about what their patients want.
I think there's a lot more to do. Sorry, I know other people have got hands up as well.
No worries, and I'm back now. Sorry, I've minimized my video, so hopefully you can hear me. But that's so we've got Isabel and then Bruce. But just to mention, it's a very good discussion point. So you know I think the question is, why do we need to revisit semantics and what does quality mean to everyone? Whereas from certainly from my point of view, that takes up a lot of my time in my work. And I can understand where Tom's coming across. You know, it's just after 70 years, do we still need to have these discussions? I completely get it. But absolutely what Emma's saying is exactly what I'm finding on the ground as well, that the definition of a customer at corporate level is very different. So the customer at corporate level is not the patients in a lot of the instances, is actually our staff and services, and it's the organizational elements that are actually the customers. And that means very different in terms of quality. Whereas, we're coming under the umbrella that quality should be all about patient safety. Well, actually, there are financial elements, there are organizational elements, and the customer definition is quite different. So I do get where Emma's coming across as well. So, but it's a really great discussion and debate. Now, Isabel and then Bruce.
Very interesting discussion. So I think, like, I don't know if anyone is aware, there's actually a set of standard, I think, developed by HQ and BSI. It's called PACS 1616. So it's
Sorry,
a set
HQ and BSI.
HQIP.
Oh, Health
sorry,
Quality
and
Partnership.
BSI. Yeah.
Yep.
So and
BSI is, sorry,
British Standard Institute.
Gotcha.
Yeah, so there's actually a set of standard developed for clinical services. So it's called PACS 1616. If you search online, you can see. So I think that would be a good starting point because it actually encompasses a lot of element you need in a QMS. For consideration. So that is developed in the UK and recognized in the UK, not internationally, but that is a standard that's already exists. And I think my other question is, like, do you actually know if QMS is something that you wanted to implement, or is that mandated regulationally? Because, like, regulatory wise, for example, our discipline is a mandated regulatory requirement. So there's no other options. Whether you choose you want to do it or not, you have to do it. But at a hospital level, organizational level, or like at a different discipline, there are different requirements. So my understanding is, for example, laboratory or pathology for radiotherapy, it is mandated. We have to do it. So when you want to implement a QMS at the organizational level in a hospital, you have many disciplines. Some disciplines are very experienced in managing, implementing, using QMS. Some disciplines are less so, or like some have no experience at all. So I think a lot of us, our experience is like, you got bits and bobs of, like, the quality management system that is kind of like used in a hospital setting. But every discipline, every department, the quality definition is different, and what you need is, from one discipline to another, because it's different. You actually need to define it in your own, in the scope of your own quality management system. For example, my scope in a radiotherapy setting will not be the same as the one in pathology. However, it is for us, like, your quality team, they will need to define and communicate this so that everyone are understanding the same language, using the the standard terminology, I guess, that you can use to communicate with your team. What does that actually mean in real life, in reality, and how do you realize this, your compliance, how you manage various different things on the ground. Because ultimately the staff, they are not likely to remember all the technical terminology a quality manager will use. So it's for you to kind of like embed that and then make the language more user friendly to help them to engage and be part of that.
Yeah,
process.
Thank you for that, Isabel. And in fact, when people were in breakout rooms, we had a chat, who is calling for the QMS, at an organizational level, and what are the reasons behind it. It might be that there are some different drivers where QMS might not be the solution, but there are drivers, that are leading people to think that QMS may be a solution. So that's a very good point. So Bruce, and then Nigel, and then we'll move on to room 2.
Yeah, just an observation, not an excuse, what I'm about to say, but an observation. The kind of the NHS and organisations within it, when it comes to quality, is almost the hardest part of the transformation at the moment. If whoever's aware of that thing, like that development continuum from unconsciously incompetent through consciously incompetent to unconsciously competent. We're in the, and we've been in it for quite a while, the bit in which is consciously incompetent to consciously competent. And we're kind of not stuck, people are moving, organizations are moving. And it's the hardest bit, I think, at the moment. To put some of this into context, I've been in the NHS 15 years. Before that, I was in the car industry. And when I joined the car industry a long time ago, it was doing all this stuff automatically. So it was unconsciously competent in that stuff. So I joined, and it's just what you do. we're not in that place in the NHS, and that's why it's the hardest time. We should try and give ourselves some comfort for that fact, but just keep on moving. Sorry, just an observation.
No, that's a really good point. And, you know, obviously going back to Don obedience, structure, process, and culture equals outcome. But, you know, at the moment we're talking about some of these systems, but, you know, there's so much workforce issues and, you know, staffing wise, you know, some organizations are actually questioning whether they're delivering a safe service. And I think exactly what you're saying, you know, if quality becomes part of our mantra, like with your example, then it's not that we'll have solutions to some of that, because we can't just recreate, you know, human beings and put them into post, but actually we've got an approach in terms of what we define and what the outcomes are. Great, thanks for that, Bruce. Nigel, and then we'll move on to room 2.
I hope you can hear me. The rain has just started to absolutely pound against the windows in the room I'm in, so I apologise if it's a bit weird sound. I'm inclined to agree with Tom to a certain extent about understanding the standards of what we're doing. If you're providing a service to somebody, you already know what you're doing, so you can set the standard yourself. It might not be a documented standard, and it might not be the highest of standards, but at least you've got a standard there if you're providing the service already. So, and that's part of the problem we have in healthcare. A lot of our processes are not documented, so nobody really understands them, and we drift away from them just so easily. And something that happens because there's no consequences becomes the new standard. I think the other comment that I was going to make is about consulting customers. I've just read Henry Ford's book, and he talks about, so this is about 1904, I think he writes his book, and he talks about that he doesn't take any notice of any of his customers because they don't know enough about how to build cars or what they want to use their cars in order to make improvements. So he's 80%, he said, talks about 80% of his, the people that respond to his are idiots, so they don't know what they're talking about. There's 5% who will complain about anything anyway. So there's only about 1 in 10 of his customers that have got anything sensible to say. And when they've got something sensible to say, I've probably got it in the back of my mind already to do. And Steve Jobs at Apple says something very, very similar. You know, he didn't go and ask his customers and ask, what would you like to see in a smartphone? Because nobody had ever heard of a smartphone at that time. So absolutely pointless him asking his customers what he wants. I think patients are very similar to a certain extent. They want our help, but basically, and they don't really know what they want from the system until it goes wrong, and then they have firm ideas of what they want. So that was just my comments, really. So
yeah, for sure, Nigel. Very interesting insights from obviously different industries and sectors, and you know, brings in line into the real question of how we work with patients and our populations to, you know, to deliver future care. Absolutely, really good comments. Right, I'm going to move on to room 2, and I had
make a couple of points.
Yeah, go for it, Tom.
I had my hand up for a bit.
Oh, sorry, I didn't see your hand up.
Yeah, it was only my hand. I haven't got one of those things.
Your physical hand. That's why I didn't see it. Sorry.
Yeah. Work standardization and work standards are two different things, and there's a lot of confusion over that. The other point I was going to make is the reason why the NHS needs quality management, proper quality management, is to eliminate error. Now, that's something that you'll find hard to take, but you need to eliminate error in the NHS. And the only way you're going to do that is through work standardization, work standards, and quality management systems.
That's a very, very good point there, Tom. And I guess what you're saying is that the same service delivered across numerous NHS facilities for the same type of people by the same type of commissioners and specs and nice guidance is delivered at various levels. And when you benchmark them, you see, you know, particularly on a national level, you see variation across a number of standard deviations. both in positive outliers and negative outliers. So why is that happening? That's a really, really great question. And obviously a QMS is an approach that aims to eliminate that variation and those errors.
And I pointed out that there are organisations that are trying to steer the NHS in that direction.
Yes.
Like Get It Right First Time and the World Health Organization.
Yep, great. Okay, Bev, Lara, Leslie and Tejet, is there anything anyone has to add or ask a question? Now's your opportunity.
Just the feedback from room 2?
Yeah, or just a question if there was one, Jem, that you would want to share with the group.
I'm not sure that was necessarily a question. I think there was some really good discussion, often about, again, language being something that sometimes gets us a bit defensive and distracted from the proper conversation. Like Teja had a really lovely point about the fact we really don't monitor process, particularly in the NHS. We tend to just get on with it because we're just busy doing many things. And I think just reflecting on his experience from having done process-based improvement and project-based improvement, and that just not being commonplace in the NHS, but that's fundamental to what QMS is.
I can come in there, Jem. Yeah, it was just an observation really about, you know, if you break it down to the most simplest level, I think, you know, there's two kind of improvements really. So I'm an advocate of process management in the organisation, but when I joined the NHS, which is fairly recently, you know, I think it's not our strongest point. So for me, you know, process management is a principal foundation of improvement, in my opinion. You know, so it's basically, you know, optimizing the performance of a process in order for it to be maintained, in order for it to be incrementally improved upon. Okay, so as a basis foundation. If an issue then occurs, then you can take that problem out and then you can set it back up into a project-based approach to improvements for Lean Six Sigma or whatever project-based approach, if it can be, you know, incrementally improved. However, I think the really key thing is if you're able to manage those processes effectively, when that project is finished, the benefits realization of the project automatically then feedbacks into the process management. So it's like two bookends really, to some extent. You go your process management as the core foundation. If there's a wider problem, you do your project-based approach, and then you go back to the process management once you've done that. I know it's a very simplistic way of explaining it, but from my perspective, that's the kind of approach that I've been working in and I was taught. So yeah. No,
absolutely. Thanks, Teja, and I'm sure you can agree that there are challenges with that, and it's, you know, not always. It sounds 100%. Simple, but it's not always so easy. No, yeah, exactly. Yeah. Right, okay, I'm going to go to room 3, and that room had Elaine, Dave, Jit, and Nigel. Any further reflections or questions for the panel from that room?
I think, sorry, I don't know about other people in the group. I think one of the things we were talking about, or I was talking about, is the question about how do you know if you've got a quality management system, a good quality management system in place? How do you know your compliance? I think there has to be some third-party validation from that. So you've got a certification or an accreditation, or somebody that's outside the organisation comes and looks at it before you can know that you've got a half-decent quality management system.
Yeah, that's a very good point. And I guess some of it is also, you know, even at a lower level, how do I know I'm doing a good job? I might think I'm doing a great job as an OT or a nurse or a doctor, but, you know, what have I got that's giving me the feedback to support my claim? And obviously,
exactly.
Exactly. Okay. Thanks, Nigel. And then room 4 was quite a small one. Matthew, Rebecca, I think, and Anne. Is there anything you guys want to add?
Was there another Matthew? Because I was in a room with quite a few people. But if you are talking about the room I was in, I mean, one of the questions that Andrea brought up was, and I don't know whether we've answered this or not, is just, will ISO 9001 just become another beast that we feed there was that kind of feeling came up at one point.
Oh, that's a great question. Right, I'm going to go to my panel. I might start with Tom first. You certainly had me scared, Tom, with the 700 plus pages of volume 1 of whatever I'm supposed to read. That's why I preferred the Scottish approach. But right, so sorry. So is ISO 900 just another beast that we're going to serve?
Yeah, no, not at all. I think Nigel's right that external certification will show that you've got a quality management system, but it would take a long time for the NHS a complete trust to get up to that standard. So there's got to be a way of doing it without involving, except for the CQC and clinical audit, there's got to be some other way of certifying your quality management system other than go into external certification, because that's very, very expensive. I can understand why that's required for labs and other elements of the NHS, but not for a trust in general. Can you repeat the question again? I've talked too much and forgotten what you asked.
I mean, the question that came up in the group I was in, someone was just saying, will ISO 9000 become another beast that we have to read?
Yeah, I think that you can start at the top and start at the bottom, and neither of those two parts for two ends for starting would become a beast. The bottom is implementing process management, and whether you say that's part of the quality management system or not, it is. So the key to quality management is process management, and defining your processes. It's not a beast that you've got to feed. It's what you're doing. It's what you do every day at work, and how you do it, and how you do it properly, and how you do it without creating error. Error is the big problem with the NHS, and there are some statistics on that in the resource that I provided. So no, it's not a beast that you feed. It can be. It certainly can be. And I've seen a lot of companies that have implemented a beast that they have to continue feeding, especially around audit time, external audit time. So it's the design of the system that prevents it from being a beast that you feed, but it's a necessity in order to eliminate error.
Gotcha. And I guess, as you've said before, Tom, it depends on your QMS maturity, right? And if you do want external sort of assurance, then obviously an ISO 900 assurance stamp kite mark is a way you can progress. Elaine, you've got your hand up.
Yes, thanks, Mirek. I wonder if I could just build on the last question and ask the panel whether they think there might be a difference between a quality management system as we describe it for an organisation and what I think I've just heard Thomas describing, which was a specific department, laboratories, for example, that are subject to quality assurance and control as a quality management system. So is there something different between those? Because I feel this afternoon we might be just confusing those a little bit in the discussion that we're having.
Okay, Tom and then Jem.
Yeah, I'll answer that. No, there isn't any difference. The scope is different. The laboratory has got a specific scope. IT, digital has got a specific scope. Pharmacy has got a specific scope. The scope would be different for each department or each, say, ward or operating theatre. The scope would be slightly different, but the quality management system is exactly the same. They still require you to document your processes. They still require you to monitor non-conformance to those processes. They still require you to look at customer complaints. They still require you to review your specifications and ensure that you're satisfying your customers' requirements. So the quality management system is the same, but as Isabel mentioned earlier, the scope is different. You're covering a different piece of work.
Okay, great. Thanks, Tom. Jem?
I was just going to chuck in an observation, because as I said, I'm not an expert in ISO 9001 in any way, shape or form, fairly new to QMS, but one of the things I've observed is we've come across a lot of different concepts, and one of the things that seems to be discussed at organisational level discussions around QMS versus about service level is the concept of strategy and strategy deployment. And whilst there's like a very small mention of it in ISO 9001, it's something that you need to consider as part of your organizational approach. How do you approach developing strategy and plans for the future that you would need to do at an organizational level that you probably wouldn't be doing to the same degree at a service level, because that's, I said, it's normally done at a higher level of the organization. So I think that's one of the key differences for me, is because a lot of the big changes that come through in terms of what a service needs to deliver on will be to do with the transformational change that needs to happen, as well as the process management. And to manage your service well, you need to be able to do both. You've got to be able to manage today and build for tomorrow. And I think that's where QMS, for me, is blurring boundaries in the way we talk about it potentially in the NHS compared to how it's defined in maybe industry, because we're kind of maybe conflating both of those into the same piece.
Yeah, that's a very good point. So, you've got your services and your clinical pathways, and then you've got your organizational sort of level approaches. Absolutely. Leslie?
Hi, I was just going to say, I suppose the difference is for labs, it's something that we've had for years, for donkey's years. It's been really well documented. We have our own ISO standard, which kind of describes everything we need to have in place. And I guess for the wider NHS, that doesn't exist. If you had something that was, for an NHS organisation, this could be your standard system. This is what you need to have in place. You need to have this governance. You need to have these hierarchies and interrelationships defined. You'll probably find, though, that for a lot of things, you already have things in place because you've got complaints, procedures and policies. You've got processes around training. You've got kind of DATEX, management of errors, PSERF, things like that. So you probably already have a lot of things in place, but it's probably just that it's not all been brought together and documented, and you don't have a set standard that you can work to. Pathology, I think almost all pathology labs in the UK, NHS ones anyway, are accredited to ISO 15189. So we're all very standardized, whereas NHS services in general, it's very complex. You've got, it's not like kind of a lab or engineering or anything like that. You've got lots of different services, comorbidities of patients. It's not as easy to kind of fit into, where we feel we've got kind of neater little boxes we can fit things in. It's not as easy to do that, I think, with a wider NHS, but that doesn't mean you can't take something that's a standard like 9001 and look at that and kind of do a gap analysis and say, okay, it's saying we need to have these kind of policies in place. Do we have that? And kind of use that as your starting point. And then you look at all the other things that you do, and you could bring those in and say, okay, we also do this. We can bring this in and we can try and standardize that as well. So I would just say that, just because we've been on this journey a lot longer and, it's very well embedded, it doesn't mean it can't be done. It's a bigger piece of work, isn't it? That kind of just needs to be looked at nationally, I think.
Absolutely. But a real positive point there, and, potentially economies of scale. So I am going to have to, we can't hear from room 5, and we also can't hear from Isabel and Nigel, but that's because my QMS approach is to make sure we finish on time as a chair. But I just want to reassure you all that these discussions are just the start, and we hope they continue. So I know Tom is going to share with Matthew and Jerome some materials that will be circulated to all participants, but they'll also be hopefully available on the Q Community website, SIG, that Tom hosts. And I know Emma and Joy just starting on a 3-part series webinar looking at, correct me if I'm wrong, Emma, quality planning, quality control, and quality improvement. So your first event is on November the 18th, so you can sign up for that via the Q Community, so please do join. And lastly, I just want to say a huge thanks to Tom Isabel, Emma and Jem for their insights and volunteering to be a panel, giving up an hour and a half of their time, and also for Matthew and Jerome to co-host this with me. So I wish you all very good Tuesday, I think it is, and you've got 1 minute back. So thank you all for joining us and wish you all well. Bye-bye.
Cheerio, thanks a lot.